Hello, and I am Dr. Corey King, DC. I'm a board-eligible clinical nutritionist, and I'm also a board-certified doctor of integrative medicine. I'm the owner of the Tustin Chronic Condition Center, and I specialize in working with patients who are struggling with chronic gastrointestinal dysfunction. Some of the symptoms that walk into our clinic are constipation, diarrhea, bloatiness, the loose stools, inability to hold the bladder, acid reflux, indigestion, heartburn. Some of the conditions, what they are called, are irritable bowel syndrome, leaky gut syndrome, celiac or Crohn's disease, your GERD. Whatever the condition is, we see patients just like you all the time in our clinic. And the only thing that matters are the results. If you're not achieving the results with your gastroenterologist, your primary care physician, your alternative practitioner, I highly encourage you to watch the next couple minutes of this video. I was a child that suffered from irritable bowel syndrome until I was 20 years old. Okay, so I'm very sympathetic with patients just like you because I know what you are going through. The number one thing that we start to look at on patients with chronic GI complications is, do you have an autoimmune condition? Is your body attacking your gut lining? You can see that in celiac and Crohn's disease, but you can also see it before you're actually diagnosed with that condition. Because the body's going to be destroying tissue of the gastrointestinal system, and it's not until those markers get high enough or they do a very specific test till they find that. Number two is we're going to look at your blood sugar dysregulation, because majority of GI complication patients are suffering from blood sugar dysregulation. The adrenal glands help to control that, and they are extremely important. Listen to this really quickly, because your adrenal glands release cortisol. Cortisol is extremely inflammatory to your gut lining. Cortisol is also extremely inflammatory to the brain. My favorite saying is, if you have a fire in the gut, you're going to have a fire in the brain. Whatever happens to your gut happens to your brain. So we'll start to see brain fog, mental clarity going down, short-term memory issues, focus and attention, all going downhill because your gastrointestinal system has been breached. In you leaky gut patients, irritable bowel patients, celiac, Crohn's disease, your gut barrier has been breached. Things are slipping into your bloodstream and your body is starting to react. Number three is we look at things like anemia, because anemia can be one of the reasons why you can't truly heal. There's 12 different types of anemia, and if your doctors aren't running a full anemia panel, they will miss this. We'll look at things like parasites, bacteriums, mold, yeast, fungi. All of these things help to fuel the fire of your gastrointestinal dysfunction. We'll also look at the inflammation that's going on, because if your body is chronically inflamed globally, we must get that inflammation down in order to allow your body to heal. And we'll also look at things like your liver and your gallbladder, because they play an important function in, one, lowering cholesterol, two, helping your body digest your foods. That's part of your metabolism as well. We must look at those 6 priorities on you. We must do the appropriate testing. And for a majority of you chronic gastrointestinal patients, the doctors are doing a horrible, horrible job. Remember, I was one of you patients at one time. Okay? Things like food sensitivities also affect how that gut heals. Those are all things that we teach you in the clinic. We educate you. So that way, once you're better, you're not coming back in the clinic. Okay? Because we want to get you better as soon as we possibly can. Because my number one mission for every single patient that walks in the clinic is to improve the quality of your life. If your doctors haven't talked to you about this, if you're still struggling with your symptoms, I highly encourage you, fill out the information below, click submit, and a staff member will be in contact with you within 48 hours. They'll schedule your consultation and they'll walk you through the next step in order to truly get your life back on track, achieve the results that you want so you can live a normal life again. Again, I'm Dr. Corey King. I look forward to seeing you in the clinic very soon.